Hello there, Dr. G. John Mullen, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist. This week's injury tip of the week from Swimming World TV is spondylolysis. So spondylolysis is an injury more specific for divers and synchronized swimmers than swimmers. However, it's frequent in all three of these sports. Spondylolysis is a stress fracture to a part of your low back called your pars articularis. So let's go over the quick anatomy of the low back here. Okay, so here's your spine, maybe not exactly yours, but something like it. You have your cervical, thoracic, then lumbar vertebrae here. Then this is the back side here. You have the stegosaurus bumps called the spinous processes. Out here on the side you have your transverse processes. And in here you have your pars articularis. The pars articularis is the spot of injury for people with spondylolysis. Okay? Spondylolysis is caused typically by repeated stresses over and over. That's why divers often have it hinging and compressing this area over and over. If you think about it, divers do 100-odd approaches every day at workout, and a lot of them, reverses and things like that, require this extension. When you extend the back, it's going to be causing a little extra stress on this area called the pars articularis. After this occurs, there's a lot of different approaches for treatment. One of the older ideas was to brace this injury and immobilize it to provide it stability. However, what studies are showing is that this bracing is not that effective. And from my own experience, there are much better means to progress from this injury and get people back on the boards, back in the pool a lot sooner. So what needs to be addressed is improving muscles in the area that often get super tight, trying to compensate for this lack of stability and provide stability. So there are muscles in your core that are meant to provide stability and ones that are supposed to help you move and be a powerful athlete. However, sometimes these muscles that are supposed to help you be a powerful athlete have to be used for stability when stability isn't present. So if you didn't guess, stability is one way to improve the symptoms by doing some core stability here, working on your transverse abdominis, a muscle that runs in this fiber orientation from the side and wraps around your stomach, and all your other core musculature like your rectus abdominis, obliques, things like that. So you have to improve muscle strength. That's one facet. You also have to improve muscle length. As I said, some of these muscles that allow you to be a powerful, explosive, great athlete also can help out being stability muscles when stability is not present. One of the main muscles is the psoas major. The psoas major attaches to all 5 lumbar vertebrae on the side, actually all 5 discs as well on both sides, and runs all the way down to the inside of the hip here. So if you can see, it flexes the hip and also flexes the trunk. But it also stabilizes and becomes very tight when it's trying to stabilize the trunk here. So one important facet to improve off of spondylolysis is improving the length of this psoas muscle. I've seen people come in and they can only bend this far, and then after some manual therapy to the psoas, they're moving this far back. Okay? So after a session or two, that's all it really takes, and they have full mobility. But just because you get that mobility back doesn't mean you're entirely stable, so that's where you have to use the adjunct of the strength. Lastly, these athletes commonly have a tough time with timing of these muscles. Okay? So if you can imagine, they have poor coordination and choreograph nature of the hip flexors and the core and things like that. So providing muscles that challenge, or exercises that challenge the muscle timing is the last facet here at the end of getting better and back to the pool or back to the boards after an injury of spondylolysis. Okay? Alright, this was spondylolysis injury of the week.